When you think about your abdomen, you probably just picture a bunch of organs, right? Your stomach, your intestines. But what if I told you that the space in between all of them is actually just as important, maybe even more so? Well, today we're going on a special tour of that inner space, the peritoneal cavity.
I want you to imagine for a second that your abdomen has its own hidden infrastructure, a whole network of highways and pathways that things can travel along. And no, this isn't science fiction. It's the actual reality of our internal anatomy, and, as you're about to see, it has huge implications for our health.
All right, first stop on our tour, let's get a closer look at the abdomen itself and really define this unique space we're here to explore.
So this space is called the peritoneal cavity. Now, it's not really an empty void. It's what we call a potential space between these two super delicate membranes, one that lines your abdominal wall and another that covers your organs. You can think of it like a lubricated sac that lets all your organs kind of slide around without any friction. But, as we're going to find out, this space also creates these channels that can guide the flow of fluids and, well, trouble.
Okay, so every tour needs a map, right? Let's chart the key landmarks and passages of this incredible internal landscape.
So the peritoneal cavity isn't just one big open room. It's actually divided into two main areas. You've got the greater sac, which is the main, larger part, and then kind of tucked away behind the stomach, there's a smaller area called the lesser sac. It also has a cooler name, the omental bursa. That's a great little piece of trivia to keep in your back pocket.
And how do you get from one sac to the other? Well, there's a small exclusive opening called the foramen of Winslow. It is the one and only natural doorway that connects the main cavity to that little hidden pouch behind the stomach. Pretty cool. And now for those highways I was talking about. The upper and lower parts of your abdomen are connected by these two channels that run right along the sides of your colon. These are the right and left paracolic gutters, and believe me, they are absolutely crucial pathways for the flow of fluid.
I just love this quote because it illustrates a really key anatomical detail with a little bit of humor. The right gutter is wider and more direct than the left, which actually makes it the preferred route for fluid travel. And this isn't just some fun fact. As we're about to see, this simple difference in anatomy has some pretty serious medical consequences.
So we've got our map and we've got our highways, but what exactly is traveling along them? Let's take a look at how this space becomes the body's superhighway for both normal fluid and, unfortunately, for the spread of disease.
Disease can move through the abdomen in four main ways. Now, we all know about the bloodstream and the lymphatic system. Those are pretty famous routes. But the structure of the peritoneum itself offers two other paths, something called direct invasion along ligaments, and another one called intraperitoneal seeding, which relies completely on that highway system we just mapped out.
Direct invasion is pretty much what it sounds like. It's when a disease spreads along the very ligaments that hold our organs in place. So as you can see here, a structure like the gastrohepatic ligament can basically act as a bridge for cancer to travel from the stomach right over to the liver. These ligaments aren't just anchors, they're potential conduits.
Okay, and this is where it all clicks together. The natural flow of fluid in our abdomen actually moves upward, from the pelvis up toward the diaphragm. And which route does it prefer to take? You guessed it, that wider right paracolic gutter. So the really crucial point here is that things like cancer cells or infections that get into this fluid can be carried along this exact path, seeding themselves in really predictable spots along the way.
All right, our tour is now going to take us to a few specific trouble spots, conditions that are basically defined by this unique anatomy. Let's look at what happens when these internal pathways get used for all the wrong reasons.
So first up is a mouthful, pseudomyxoma peritonei. This is a pretty rare condition where this thick gelatinous fluid, it's a type of fluid buildup we call ascites, fills up the entire abdomen. Most of the time, it starts when a mucus-filled tumor on the appendix called a mucocell bursts. This gelatinous stuff then spreads all through the peritoneal cavity, just coating the organs and causing these awful, debilitating bowel obstructions. So how in the world do doctors spot this? Well, on imaging scans, all that gelatinous material presses on the surface of the liver and the spleen, and it creates this really distinct scalloped edge. This scalloping of the liver is the classic diagnostic sign. It tells a radiologist exactly what they're looking at. Another big sign of trouble is something called omental caking. See, the omentum is this fatty apron that hangs down in the abdomen. When cancer cells get carried by that peritoneal fluid and implant themselves on it, they can cause it to get really thick and hard. This cake of tumor then physically pushes the bowel away from the front of the abdominal wall. It's a really clear and ominous sign of advanced disease. So what happens if something foreign gets into this space, say during a medical procedure? Well, if doctors think there might be a leak in the GI tract, they will not use barium contrast. Why? Because if barium leaks into the peritoneal cavity, it triggers this massive, full-body inflammatory reaction called peritonitis. But even worse, in a really rare scenario, it can leak directly into the bloodstream. That's called intravasation, and it can cause a fatal embolism. This is precisely why a much safer water-soluble contrast is used instead.
All right, to wrap up our tour, let's look at one final, classic sign that doctors use to diagnose a problem in this space. It's a perfect example of linking our anatomical map directly to a real-world diagnosis.
Okay, so the mesentery is the tissue that anchors your intestines, and it is just packed with blood vessels. A type of cancer called mesenteric lymphoma can grow right here, forming a huge mass that wraps around and completely encases these critical vessels. And when this happens, it creates an unmistakable image for doctors. The big mass of the tumor on either side of those mesenteric vessels looks exactly like it's sandwiching them in the middle. This sandwich sign is another one of those key buzzwords that points a doctor right to a diagnosis of lymphoma.
So, after all of that, what have we really learned on our tour? Well, the key thing to remember is this. The abdomen isn't just a random bag of organs. It's a highly structured space. And that very structure creates the superhighways we've been talking about, which then dictate how fluid and disease moves around. By understanding this internal map, doctors can read these telltale signs, like liver scalloping or the sandwich sign, and they can predict exactly where trouble might go next. It completely turns the idea of empty space on its head, making it a roadmap for diagnosis.
And that brings our tour to a close. It just goes to show you that sometimes the most important structures aren't structures at all, but the spaces in between. Now that you know about the secret highways hidden inside you, I have to ask, will you ever think of an empty space the same way again?